Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. So in this video I will go over the top 5 tips that will help to relieve back pain immediately. Before doing that, I will go over the normal healing cycle because that will help us to understand why those tips will be helpful. And before that, actually, I will go over the causes of the back pain so you will know if the tips will be applicable to that cause or not. In the future video, I will have in more details about the causes, so make sure you subscribe to my channel to have access to those videos. So first, normal healing cycle. So our body has to go through 3 stages in order to heal. The first stage is inflammation. Again, I use external paper cut for visualization, but the same process happens internally with accident, trauma, poor posture, poor body mechanic, or any injury. The body has to go through those 3 stages. If it went through those 3 stages, that means the body healed and there's no back pain or no conditions. But when we see patients in the clinic, they usually have issue either inflammation or in the proliferation stage. So for external paper cut, the first stage is inflammation, swelling, redness, the blood starts to rush to that area. The second stage is the proliferation stage. That's when our body starts to build a scar tissue. And there's a cascade of events happen during that stage. I'm just going over the scar tissue just for visualization, but I have detailed videos about scar tissue, fascia restrictions, and muscle spasm and trigger points in my channel. Feel free to check those videos. I have in detail talking about each topic. In perfect scenario, actually our body gets rid of scar tissue and clears up the tightness and the muscle spasm, and that's end up with the maturation. When you have a back pain, you're really not in the maturation stage because that means you're already healed. So looking at this cycle, it does not matter what diagnosis you have or the causes, everything has to be tied to the normal healing cycle because this is the our normal body programming, that it has to go through that. So it does not matter what type of injury. We just give labels for injury to know the signs and symptoms, but that does not help us to know where the patient at in the normal healing cycle, and that's a different way of thinking of treating patient. And usually ASTR healthcare provider are trained to really figure out the source of the problem or where the patient is actually located in that healing cycle, instead of looking at symptoms and labeling like back pain related to certain conditions. Over the common causes for lower back pain, I will go over these causes very quickly, but I will have a future video that actually go into detail on these causes and how we can work on each cause to eliminate the pain. So the most common cause is poor posture, poor body mechanics. Poor posture with slouching in the front of the computer or using your cell phone, sitting posture, computer posture, poor body mechanic with lifting and reaching, those most of the common causes. The second common cause is muscle strain or ligament strain, sprain, and that's usually happen as a consequences of the poor posture or poor body mechanic. So the third cause is radiculopathy, and sometimes they call it sciatica. That's when there is inflammation in the nerve or in the back that compress on the nerve that going down to the legs and cause radiculopathy or sharp radiated pain to the leg and feet. The fourth cause is arthritis, and that could be rheumatoid arthritis or osteoarthritis. Those are the top common causes that's in the back in the vertebrae. The fifth cause is herniated disc, so it could be bulging disc. Sometimes it's actually false positive for bulging disc or herniated disc, and I will go over that in detail in the future videos. Cause for back pain is fracture of the vertebra, and that's not very common, but that's one of the causes. If you have this issue, you will not be able to sit to stand, to find comfortable position. It's an emergency room situation. So if you really not able to be in one comfortable position, you need to go to see your healthcare provider. You need to go to the ER to get MRI and figure out what's going on, or X-ray to see if it's truly fracture. Number 7 is scoliosis. That's also will cause back pain. I will have a video on the scoliosis. What are the 5 tips to relieve back pain? So we'll go back to the normal healing cycle. If your condition not fracture, or it's not like herniated disc that pushing on the nerve, you will probably feel relief with these tips. So the first step is avoid any exercise or activities that cause pain. So if slouching forward that causing pain, you need to avoid it. If maintaining one position for a long time that causing pain, or exercising causing pain, you need to listen to your body. So think about pain like a check engine signal in your car. So if you have pain, or you have a check engine signal light in your car, there's 2 options for it. One is cover the light and just keep driving and hope for the best. 2, just figure out what the problem, and the light will turn off by itself. Unfortunately, the mentality of no pain, no gain is very common, even in the medical field, in physical therapy, or chiropractor, or OT, that they push the patient through the pain. But the problem is, do you know why there is pain? And think about this way: if you have a micro tear in your muscle, and you actually push the pain, that micro tear is going to be a major tear. So do no harm. Please do not do activities that cause pain. So in this study, this is a systematic review that looked at the effects of exercises and physical activity on non-specific chronic low back pain. So this is a systematic review. They looked at a lot of different databases, and they found 14 studies that actually meet the criteria to be included in these studies. And based on 14 studies, they came up with this conclusion: exercise intervention programs involving either muscular strengthening, flexibility, or aerobic fitness is beneficial for non-specific chronic low back pain, but not acute low back pain. Non-specific acute low back pain patient recover in 4 to 6 weeks with or without treatment. And exercising should be avoided to reduce the swelling of the affected area. So let's pause here. So going back to the healing cycle. So acute stage, they actually have a tremendous amount of inflammation. So if you have a significant inflammation and you keep exercising, you're actually going to inflame it more, which is actually going to cause more scar tissue, and that will need medical attention and treatment. So based on those studies, actually you need to avoid exercises that aggravate the symptoms. They looked at the impact of stretching on sports injury risk, a systematic review of literature. So the studies that actually met the qualification to include it in this study is 6 studies. So this is a conclusion of 6 studies. Stretching was not significantly associated with a reduction in total injuries. So, and there's much more studies. I will go over that and why you should not stretch video. in the future. So the main important point to avoid activity that cause or exercise that cause pain. Second tip is move every 15 to 20 minutes. So if your job requires you to sit in the front of the computer, you need to set up a timer, sticky note, timer in your phone or your computer. Every 15 minutes, get up, walk around, grab a cup of water, just move around, just move your muscles around. That will be beneficial than stretches or maintaining one position for a long time. Third tip is be active. So if walking does not aggravate your symptoms, hiking does not aggravate your symptoms, swimming does not aggravate your symptoms, just move. Do not stop moving. Do not put your life on hold as long as the activity is not painful. And recommendation for hiking, make sure it's a flat, not really hiking that requires a lot of stress on your back. But listen to your body is more important, and just be active, move around. The fourth tip is avoid hamstring and piriformis stretch. So I just reviewed the study for the stretches that is not really helpful to decrease injury, and stretches by itself is not really helpful to really reverse anything. And think about this way, and going back to the healing cycle, in the proliferation stage, that where you have a scar tissue or fascial restrictions, that cause tightness in the muscle. So think about our muscle should act like a rubber band. So when it contracts and relaxes, it should be able to stretch. When you have a scar tissue or fascial restriction, it's like you have a knot in a rubber band. So when your muscle stretch, does not really go further. And that's why they prescribe, or when you look on YouTube, the first thing is a stretch. But it doesn't make any sense. If you stretch and you have a knot and you overstretch, you're gonna snap the band. Actually, overstretching could cause muscle strain, so you want to be careful. And actually, studies showed it's not helping with anything. So the definition of an insanity, doing the same thing and expecting something different. So avoid stretches, especially the hamstring and the piriformis stretch. Unfortunately, this is the first thing I learned in the school for back pain patients. Just do those stretches, but study actually showing it's not really working. So why hamstring and piriformis stretch could be harmful actually? Because the sciatic nerve goes between the piriformis muscle. So if that's your anatomy and you really constantly stretch your piriformis or hamstring, you're squeezing on your sciatic nerve. And I had patients, actually, they had minor symptoms, and they looked on YouTube. The first thing everybody was saying, stretch a hamstring and the piriformis muscle. They did that, and they could not even walk. And because they compressed more on the sciatic nerve, that actually caused more radiated sharp pain to the legs. That patient his pain was 4 out of 10 before stretching. After stretching, the pain was 8 out of 10. So avoid hamstring and piriformis stretch. And in the future, I will go over exercises that are more effective than the stretches, being based on research. So the fifth tip is do not put your wallet in the back pocket. That's especially for guys. You put your wallet in the back pocket, that could compress on sciatic nerve, cause radiculopathy, or actually get your pelvis out of alignment, and you will be sitting like crooked, and that will cause more degeneration on one side than the other side because your weight not evenly distributed. And I will give you another free tip, which is number 6, avoid any lifting during this stage, because lifting heavy weight actually gonna transition that to your back and will put more pressure on your back. And in a future video, I will just have more tips on how to treat each cause of the back pain. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.